Um, Good morning. We're with you this morning to talk about Dementia Friendly Missoula. My name is Terry Egan. I'm a volunteer with Dementia Friendly Missoula, as is my co-presenter, Kelly Moore. When we're not volunteering, though, we do have other jobs. And so I am the Associate Director of the Montana Geriatric Education Center at the University of Montana. And we're involved in a lot of geriatric programming, and dementia is one of our primary topics. Kelly.
Thanks, Terry. It's nice to be here this morning with Terry, and I just wanted to let you know I'm with Missoula County Extension, Montana State University. So I'm also involved in a lot of caregiver programs.
All right, I'm going to go ahead and share my screen and start our presentation. So this is a introduction to Dementia Friendly Missoula. It includes information just general to dementia and types of dementia, and then also some things that we're interested in sharing with people about how to make our community more dementia friendly. Dementia Friendly Missoula is affiliated with Missoula Aging Services. And so there's their information. In order to contact Dementia Friendly Missoula, you can contact the Missoula Aging Services, and we'll give you that information again at the end. So what is Dementia Friendly Missoula? Dementia Friendly Missoula aims to help Missoula businesses, organizations, and other groups to understand and adopt dementia-friendly practices that will maximize quality of life for individuals with dementia. It'll help maintain their independence. We want to also support the individual and their caregivers. So what is dementia? Dementia is an umbrella term, and it's used to describe a range of symptoms associated with cognitive impairment. We often hear about Alzheimer's disease, but you might also have someone say, oh no, my mother doesn't have Alzheimer's, they have dementia. A lot of times it's very difficult for our primary care providers to determine what kind of dementia it is. There are some tips or hints that can tell them, and we'll talk a little bit about each of these and some of the different kinds of dementias there might be. As I said, Alzheimer's is the most prominent, and it is a progressive disease of the brain that causes the brain cells to die. It impairs our memory and functioning and can also affect our behaviors. Vascular dementia is when blood vessels are clotting or there's a bleed, and this often follows a very stepwise progression or trajectory of symptoms and of cognitive decline. Where Alzheimer's is more of an even kind of downhill. Vascular dementia, you might see people on a level plane for a while, and then a stair step and they're at a lower level, and a stair step and they're at a lower level. Lewy body dementia is often, but not always, affiliated with Parkinson's disease. So someone who has Parkinson's may develop this kind of dementia, and or if you develop this type of dementia, you may develop Parkinson type features as well. This dementia is characterized by sleep disturbances, hallucinations, and visual difficulties. What's interesting here is the visual hallucinations are not scary or harmful, but they're friendly. It's sort of like friendly ghosts or people from the past that the person has loved and cared for. You know, it could be a parent or a sibling. And so the hallucinations are not, always disturbing to them. And then the frontal temporal dementia is more of a brain shrinkage. And we often with frontal temporal will see that in younger people, like younger than 65. And then we see changes in their behaviors and in their personality, and language is often lost fairly quickly. So those are some different types. There's mixed dementias. There's a whole different range of dementias that are possible. What's important to know is they all have similar progression of the disease and outcomes. So we know that Alzheimer's is a public health crisis. Of the top 10 leading causes of death for people 65 and older, Alzheimer's is their number 5. You can see on my chart. It is the only one, however, without a way to prevent, treat, or cure. We're hearing a lot of things on the horizon, especially this year in 2021. There are new drugs that are becoming available that we have some hope. There's also a lot of new hope in how we stop or prevent dementias from occurring. So we'll talk about that a little bit later. The burden is large, though. How many people, many of us know someone or have a family member that has dementia. Here in Montana, about 22,000 people age 65 or older are living with dementia. And we expect that number to reach 27,000 by 2025, which is only 4 years away. Here in Missoula County, there's 18,000 people over the age of 65, and about 11% of those have dementia, or about 2,056 people. And of that, 15% of those live by themselves. So we know a little over 300 people in our community are living with dementia, and they're living alone. So what does that mean for our community, and what can we do as a community to support those people with dementia? Well, we can become dementia friendly. And so what does that mean? Being dementia friendly means being able to recognize the signs of dementia. We want to communicate effectively with the person living with dementia. We want to be able to identify and implement dementia friendly practices in our homes, our businesses, our community. We want to know what resources are available. So if we talk to a person with dementia or a caregiver, what can we offer to them as far as resources and support? And again, Kelly and I both talked about caregiving. Caregiving, especially for people with dementia, is a 24/7 life. And so we want to support caregiving staff. We want to support family caregivers, people in the home, neighbors, anyone that's helping to care for people with dementia. And so we want to learn how to support those caregivers and learn why that's important to us in our community. And so now Kelly's going to take over.
Thank you, Terry. We're going to talk about possible clues of dementia. Looking or saying that they are confused or a bit lost. Someone might have difficulty making choices, difficulty searching for something, thinking that something is lost. Speech might be difficult to understand. There might be a difficulty in handling money and also in writing or filling out forms. Okay, next slide, please. Thank you. So what is important to those living with the early stages of dementia? It's important that they have the ability to make plans for their future care, that they have something to contribute. Just shopping and eating out, things that we take for granted. Those are difficult things to do with people with dementia. Connecting to family and friends is still very important. Just engaging in the daily activities, visiting places of worship, and people want to feel at home in their community. Next slide, please. So what are some of the internal barriers for those that live with dementia? Oftentimes there's a lack of confidence. They worry about being confused. There's a stigma or lack of understanding about dementia. There's a worry about getting lost. There are mobility and physical health issues. And also, no one wants to be a burden to friends and family. Okay, next slide. Some of the external barriers for those who live with dementia. Sometimes there's a lack of support to allow them to continue their activities that they're used to being a part of. There's a lack of appropriate activities to do. Sometimes there's a lack of adequate and safe transportation. Maybe the signage is difficult. It allows people to become confused, or maybe the signage might be missing altogether. There's a difficulty recognizing dementia, and there's a limited knowledge of communication techniques. Okay. Next slide. So these are some of the reported experiences from people with dementia. They spoke too quickly. It was too loud. They talk so much, it confuses me. He wouldn't even look me in the eyes. She rushed me and I couldn't think. They treated me like they didn't care. These are some helpful approaches that we can all learn. We should make good eye contact. Maybe a friendly smile would put people at ease. Slow our speech if needed, one question at a time, so that someone will not get confused. And give people time to respond by being better listeners. There are a couple more helpful approaches. Maybe we can offer to help. Maybe try different forms of communication. Reduce distractions if possible. Don't take things too personally, and avoid a patronizing tone of voice. In other words, be kind, be calm, be patient, and try to embrace their reality. We should all work towards creating a dementia-friendly environment, and that's what we do in Dementia Friendly Missoula. We want to make sure that entrances and exits are marked clearly. You could use colored rugs, not black, because people with dementia often say that black rugs make them feel like they're going to fall into a hole. You should design large and easy to read directional signs or arrows, such as the one you see at the restroom, and have more family restrooms that would allow someone else to accompany the person going in. For a more friendly, a dementia-friendly environment, make sure that the lighting is good, install that. Design some quiet areas for someone to take a step away. Include seating in large spaces. Ensure that areas are free of clutter so that tripping would not be a possibility. And use maps. Next slide. What about caregiving staff? These are some statistics that maybe you weren't aware of. 1 out of 6 employees are caregivers themselves. Typically, they are more female than male, 60% female, over 40% male. 25% millennials who were born from 1981 to 1996 make up a very large portion of caregivers. Okay? These statistics are from the AARP supporting caregivers in the workplace.
Okay. Thanks, Kelly.
You're welcome.
So why do we want to support our caregiving staff? And the reason why, as an employer or even as a in an organization, why do we want to support our co-workers, our people that are helping us in our projects in their caregiving role? And we can do that to maximize productivity, but it also really helps to improve that employee or partner's physical and emotional health. We can attract and retain talent if we're known as a good worker, a workplace or organization that understands people have challenges in their life, and especially where caregiving is involved. It can also reduce health costs and indirect workplace costs. Some supportive measures for caregiving staff is some leave and flex time policies. If you have some flexible time and some leave policies that let people leave not only for their own illness, but for taking a loved one to a doctor's or to appointments, that can be very helpful. It's also good to have resources for caregiving help. Know what's available in your community. Programs like the Extension Service and Missoula Aging Services have some caregiver support programs or some support groups. And so it's important to get people hooked up with those. And it's just support for those caregivers themselves. They feel good because they know at work they're being understood and they've got some support there. So we're going to change gears a little bit here. And also just as far as businesses and caregiving, that is really important for your program. But as I said, we're going to change gears here and talk about a recent research report that suggests lifestyle changes may reduce your risk of dementia, regardless of your genetic risk. I like to say that this is, those things your mom always told you to do. And so, these are things that research is showing will reduce your risk or can reduce your risk of dementia. Things like eating a heart-healthy diet, exercise, keeping your mind active, staying connected, and those connections we find with others are really important. Check your hearing, air pollution, which we don't often have as much control of, but we can do some things like control our blood pressure. We can manage our weight. We can not smoke. We want to make sure that we get enough sleep. And we want to use head protection when we're out doing risky activities like in our area, skiing, bike riding, those kinds of things. We need some head protection. And then moderate alcohol use is okay. So we want those things with an asterisk. We're saying that dementia-friendly communities can help address these risk factors, and we can help people, by having a community that has exercise options, for people with dementia or before they have dementia. We can get involved in lots of activities in our community to keep our mind active and stay connected. And we can all work on managing our weight. So those are things that are good. And there's a lot more information. Again, as I said, in 2021 is, I think, going to be an exciting year. And there was some new research and data coming out to show that these things are truly helpful in that reducing our risk for dementia. So that is our presentation for today. We'd like to thank our partners with us, including Missoula Aging Services, the University of Montana Geriatric Education Center and Rural Institute, the Alzheimer's Association, Dementia Friendly America, the Fraternal Order of Eagles, and the Montana State University Extension Service and Missoula County Extension, where Kelly is with today. So if you have questions about dementia, or you'd like to schedule a program for your business or organization to talk about dementia, you can contact Missoula Aging Services at 406-728-7682. All of us with Dementia Friendly Missoula are volunteers, and so they will make sure to get in contact with our group and let us know that you have an interest, and someone will get back to you. We are also always looking for people who want to volunteer or be part of our committee or group. And so if you're interested in that, you're also welcome to call Missoula Aging Services and leave your contact information, and we can get you involved in the group. Or if you just want more information, we can put you on our mailing list where we provide each other with information about dementia and dementia activities in our community. So that is our program for today. Kelly and I would like to thank you very much for joining us and learning more about dementia and learning more about Dementia Friendly Missoula.